Africa is endowed with diverse livestock, aquatic animals, and wildlife resources, critical to supporting incomes, livelihoods, nutrition, food security, and resilience in much of the continent. On average, livestock alone contributes 35% of the national agricultural GDP. Despite abundant animal resources, Africa remains the world's poorest and most underdeveloped continent due to various causes, including deadly diseases, poor governance, and insufficient compliance with international health regulations, IHR, and legislation, climate change, and actors' vulnerability in the sector. Given the above, any effort to reduce food insecurity, malnutrition, poverty, and build resilience should also focus on the animal resource sector. The status of animal health and welfare is among the significant challenges affecting its productivity, growth, and sustainability. For instance, most of the 117 World Organization for Animal Health (OIE) listed diseases and infections are endemic in Africa. There is a high prevalence of OIE non-listed diseases that negatively impact the productivity and welfare of animals and their resilience to climate change, and posing public health challenges for Africans. In economic terms, animal diseases have significant impacts through direct loss of animals, high cost of treatment, lowered productivity, and market disruptions. According to the 2016 FAO report on animal diseases economic analysis, African farmers lose over $2 billion annually due to contagious bovine pleuropneumonia, CBPP alone. As shown by the 2013-2016 Ebola epidemic in Western Africa and the recent COVID-19 pandemic, zoonotic diseases can have devastating long-term impacts on countries' economies. Implementing effective strategies for preventing, controlling, and eradicating animal diseases is necessary to avoid such losses. Therefore, effective and efficient delivery of animal health services is central to the required improvements in animal health, animal production and productivity, safety of foods of animal origin, public health, and a healthy environment. To address the challenges in the animal resources sector in Africa, the Africa Union Inter-African Bureau for Animal Resources AUIBAR, Specialized Technical Office of the African Union Commission AUC, consulted partners among them, the regional economic communities, the Food and Agriculture Organization FAO, the World Organization for Animal Health OIE, research institutions, academia, and various stakeholders developed the Animal Health Strategy for Africa AHSA 2019-2035. The strategy is complemented with a monitoring and evaluation framework and implementation plan. The strategy, validated in November 2018 in Kigali, Rwanda, has been endorsed by the African Union Specialized Technical Committee, which comprised the ministers in charge of animal resources, water, agriculture, and the environment. The strategy was approved by the Heads of State Summit in February 2020 in Addis Ababa, Ethiopia. The Animal Health Strategy for Africa AHSA 2018-2035 is a continental framework for delivering a sustainable animal health system that meets global standards, healthy animals for enhanced livelihoods, safe trade, public and environmental health. It aims to address the challenges facing animal health service delivery in the African continent. It is aligned to the Livestock Development Strategy for Africa, LIDESA. Further, it provides more focused strategic interventions and approaches to addressing bee and aquatic health holistically in the continent of the One Health OH approach. It also helps to harmonize animal health services in the continent with relevant global, continental, and regional strategies and frameworks. Therefore, it serves as an overarching strategy to enhance animal health interventions, efficiency, and effectiveness in the continent. The strategy aims to address the challenges of delivering animal health services in a harmonized way within the context of the One Health approach. The One Health approach is a collaborative, multi-sectoral and transdisciplinary approach for working locally, nationally, regionally, and globally to achieve optimal health and well-being of all animals, people, plants, and their shared environment, recognizing as well as their inextricable interconnection. Africa's One Health approach includes neglected endemic diseases and strengthening intersectoral linkages and public animal environmental health interfaces. AHSA is expected to contribute to achieving the aspirations of the African Union Agenda 2063 and the Malabo Declaration on Accelerated Agriculture Growth Transformation for Shared Prosperity and Improved Livelihoods, Assembly AU Declaration 1/23, the Africa Continental Free Trade Area and the Feed Africa Strategy. Besides, the AHSA will contribute to the objectives of the Livestock Development Strategy for Africa, LIDESA, Animal Welfare Strategy for Africa, AWSA, the Policy Framework and Reform Strategy for Fisheries and Agriculture, PFRS, African Strategy for Combating Illegal Exploitation of Wild Flora and Fauna, and the Policy Framework for Pastoralism in Africa, among others. Implementing AHSA will lead to improved capacity to anticipate and mitigate the negative impacts of animal diseases, zoonosis, climate change, and disasters for healthy and productive animal populations, and increased access to regional and international markets for African animals and animal products. It will also lead to improved engagement of all value chain sectors, considering gender inclusivity and youth in animal resource development for enhanced economic growth and social welfare of African populations, thus putting Africa in the world animal resource economic.